Come on. Okay. That's my thing.
Go Habs go, I don't know.
Good afternoon and bon après-midi à toutes et à tous.
Good afternoon to everyone.
I responded to a question about the outlook for a COVID-19 vaccine. Not surprisingly, there has been a lot of interest since then, so I'd like to expand on this a bit further today. First, I'll begin with the usual update. There have been 120,132 cases of COVID-19 in Canada, including 8,987 deaths. 88% of people have now recovered, and labs across Canada have tested over 4,500,000 people for COVID-19 to date. Over the past week, an average of 43,000 people were tested daily, with 1% testing positive. Based on the most recent 7 days, there have been an average of 443 cases reported daily from across the country. Vaccination is one of the top public health achievements of all time, providing safe and effective prevention of serious illness, disability, and death due to infectious diseases, saving an estimated 2 to 3 million lives worldwide every year. Up until now, the world has never before worked as quickly and with such global solidarity on the technology and science required to rapidly produce a vaccine that will save lives and reduce the overall health and societal impacts of the COVID-19 pandemic. Getting this done in record time is no easy feat, as we must ensure any vaccine demonstrates the highest standard of safety and effectiveness. There are many steps and partners across research, government, and industry required to produce and deliver a safe and effective vaccine. All steps and partners are crucial. Nothing gets cut. Instead, fast-tracking means all hands on deck to increase collaboration, tighten partnerships, and to prepare, plan, and run as many steps in parallel as is feasible and appropriate. From developing and testing for safety and effectiveness, and manufacturing at scale to acquire, distributing, and finally administering and monitoring vaccine programs, many partners have been working tirelessly. But when the time comes, the ultimate success of a COVID-19 vaccine in Canada will depend on Canadians across the country rolling up their sleeves to receive the vaccine. Beyond protecting us as individuals, vaccination triumphs when we can build up immunity at the population level to create community immunity. This is what we'll need to bring to the spread of COVID-19 under widespread and lasting control. Currently, several COVID-19 candidate vaccines have initiated phase 3 clinical trials. This phase was preceded by phase 1 and 2 trials that demonstrated the safety of the candidate vaccines, as well as their ability to stimulate an immune response in a small number of people. The current phase 3 trials involve tens of thousands of people to evaluate the safety and effectiveness of these COVID-19 vaccine candidates for preventing infection or the disease. Even after a vaccine is approved for use, as always, there will be ongoing data collection to monitor safety and effectiveness in the population. Regardless of which vaccine or vaccines successfully obtains regulatory approval, scaling up production, distributing the vaccine worldwide, and dispensing it to Canadians will be a very big task, and it is one we continue to plan for. I am cautiously optimistic. A successful vaccine can't come soon enough for me. Thank you.
Bonjour.
Hello. Last week, Dr. Tam and I answered a question on the outlook for a COVID-19 vaccine. Not surprisingly, there has been a lot of interest since then, so I'd like to expand on this a bit further today. First, I'll begin with the usual numbers update. There have been 120,132 cases of COVID-19 in Canada including 8,987 deaths. 88% of people have now recovered. Labs across Canada have tested over 4,500,000 people for COVID-19 to date. Over the past, an average of 43,000 people were tested daily, with 1% testing positive. Based on the most recent 7 days, there has been an average of 443 cases reported daily from across the country. Vaccination is one of the top public health achievements of all time, providing safe and effective prevention of serious illness, disability, and death due to infectious diseases, saving an estimated 2 to 3 million lives worldwide every year. Up until now, the world has never before worked as quickly and with such global solidarity on the technology and science required to rapidly produce a vaccine that will save lives and reduce the overall health and societal impacts of the COVID-19 pandemic. Getting this done in record time is no easy feat, as we must ensure any vaccine demonstrates the highest standard of safety and effectiveness. There are many steps and partners across research, government, and industry required to produce and deliver a safe and effective vaccine. All steps and partners are crucial. Nothing gets cut out. Instead, fast tracking means all hands are on deck to increase collaboration, tighten partnerships, and to prepare, plan, and run as many steps in parallel as is feasible and appropriate. From developing and testing for safety and effectiveness and manufacturing at scale, to acquiring, distributing, and finally administering and monitoring vaccine programs, many partners have been working tirelessly. But when the time comes, the ultimate success of a COVID-19 vaccine in Canada will depend on Canadians across the country rolling up their sleeves to receive the vaccine. Beyond protecting us as individuals, vaccination triumphs when we can build up immunity at the population level to create community immunity. This is what we'll need to bring the spread of COVID-19 under widespread and lasting control. Currently, several COVID-19 candidate vaccines have initiated Phase 3 clinical trials. This phase was preceded by Phase 1 and 2 trials that demonstrated the safety of the candidate vaccines, as well as their ability to stimulate an immune response in a small number of people. The current Phase 3 trials involve tens of thousands of people to evaluate the safety and effectiveness of these COVID-19 vaccine candidates for preventing infection or the disease. Even after a vaccine is approved for use, as always, there will be ongoing data collection to monitor safety and effectiveness in the population. Regardless of which vaccine or vaccines successfully obtain regulatory approval, scaling up production, distributing the vaccine worldwide, and dispensing it to Canadians will be a very big task, and it is one we continue to actively plan for. We are cautiously optimistic. A successful vaccine can't come soon enough. Thank you.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and one follow-up only. For those asking a question in the room, we ask that you make your way over to the freestanding mic. We'll start on the phone. Operator, over to you.
Thank you. Merci. Our first question, notre première question nous vient de Mia Rabson with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. Dr. Tam, this is for a question for you. I think you mentioned the vaccine and how important it is to make sure that it's safe. Obviously, reports out of Russia today saying that they've approved the first vaccine. Do you have any concerns about that approval specifically and its impact on people's confidence in any vaccine that might be produced in Canada or for Canadians' use?
Well, I can't comment on the approval process for the Russian vaccine. Certainly in Canada, Health Canada is the regulatory authority and has solid processes, regimes in place so that before Health Canada approves a vaccine in any way, they will look at all the data that is produced through these phase 1 to 3 trials, and the system is, has been in place for a long time, and we have, of course, as people have seen, safe and effective vaccines in use in Canada. So I think that I have confidence and trust in the Canadian regulatory system. And the reason why I'm cautiously optimistic isn't because I don't think this is a great thing that there's all these inventions all over the world. This is very exciting. But that in this whole process, the key is that we ensure safety and the data on effectiveness or efficacy and quality assurance, which is what the regulator does, is as the most important aspect of the process. The other thing is that I do know that our regulatory scientists and authorities are linked in with international regulatory authorities to share data as rapidly as possible, so that if there were any signals of concern, we expect that to be shared internationally as well.
Thank you, Doctor. Follow-up?
Yeah, last week you released your recommendations or your guidance for returning to schools and talked about the evidence being relatively small for kids getting very sick or spreading the disease very widely. And now we're seeing reports out of the U.S. that 97,000 American kids have been diagnosed with COVID-19 in the last 2 weeks. And I'm just wondering if those statistics give you any pause on that evidence that you cited last week.
Well, I think, as I said, we will learn more and more about this virus as time goes by. We have had, of course, reports of cases in persons under the age of 20, so 19 and under. I think we and that's posted. Just trying to look for. I think it's like over 900 cases to date. But obviously a lot of the schools have been closed, so we need to sort of watch that carefully. But to date, that has not been the epidemiologic picture. But I think, as I've said last week, younger children in particular, from the international studies so far, is not as efficient at transmitting the virus than older kids and adults. And the disease severity appears to be lower in children. So I think, as with reopening any social and economic space, we expect local jurisdictions and education and public health departments to work together with parents, teachers, to do it in a cautious way and monitor what happens. The key is that we diagnose cases rapidly, investigate the dynamics of what's going on, contact tracing fast, and being able to address any sort of clusters as fast as possible without necessarily, impacting, to be as localized as possible with those measures instead of, widespread school closures or impact is the goal. But we do have to watch what evolves in the Canadian context. In the US context, of course, some of these communities have higher levels of virus transmission. And I think that is one of the key factors, is to understand your local virus transmission patterns and epidemiology as schools reopen.
Thank you. Operator, next question.
Thank you. Merci. Our next question, notre prochaine question is from Michel Lamarche avec TVA.
Question from Michel Lamarche with TVA. Question. Hello. I would like to hear you speak about Russia. In your opinion, is the approval process for that vaccine, which was announced this morning, seems a bit fast to you? Answer, Dr. New. Thank you for the question. It is difficult for us and for myself to comment on what is currently happening in Russia. I know that worldwide, there really is good cooperation between scientists and regulatory authorities regarding ongoing research for a vaccine. Here in Canada, we have a very trustworthy system that Canadians can trust for any vaccine that gets approved in Canada. The system is very effective and is supported by a lot of data to ensure the safety of the vaccine. I'm not sure if the same system is in place in Russia. But what we can say is that it might be effective to look at the number of trial phases that were used, how many people participated in the phase 3 clinical trials, etc. I think that is important for experts outside of Russia to consider when they look at the situation in Russia. But for us, I think the most important thing is to look at what we're doing here in Canada with our regulatory approval process. Thank you. Follow-up question from Michel Lamarche. I heard Dr. Tam answer in English a little earlier, saying that Canada has a very well-established system before it approves a vaccine. Given the parsimonious information we have received regarding this Russian vaccine, do you think Canada could approve such a vaccine, given the lack of information? Answer, Dr. New. No, I don't think so. Far too much information is missing. I think that when it comes to the technical and scientific side, we can say that there is a very good cooperation worldwide. When it comes to politics, that's another story. As for us, we will continue to work together with our partners around the world. And I will let other experts comment on the political side. Thank you. Next question.
Thank you. Merci. Our next question, notre prochaine question, is from Sharon Kirky with the National Post. Please go ahead. À vous la parole.
Hi, thanks for taking my question. Dr. Tam, Anne Longfield, the Children's Commissioner for England, said in an interview yesterday that testing of staff and students should be sort of part and parcel of school reopenings, and that tests should be carried out regularly, perhaps weekly. We know that, school-based testing for the virus has been done in places like Germany, but here the provincial plans for school reopenings are pretty much silent on the issue of random or regular testing of kids and teachers. We're asking parents to screen children before sending them to school and teachers to self-screen. But, given that so many people are asymptomatic, would you say that's sufficient? I mean, what are your thoughts on school-based testing? Wouldn't it give us some kind of early warning system?
Yeah, I think it's an concept that people have proposed and will continuously evaluate these kind of approaches. But given the technology available to us right now, and we continuously pursue new diagnostic capabilities as well. But right now, I think trying to test people on a regular basis and children in particular, and teachers, it is not part of the approach. The key is obviously stay home, you're sick, and any time that you contact someone or if there's been an outbreak, of course, asymptomatic persons will be advised by local public health in terms of testing in that context. So if you actually had a case in your school, we expect rapid response and in terms of testing and looking at contacts. But, I think right now the technology in Canada doesn't support that kind of approach. And if you're asymptomatic, the tests right now, really have, we're assessing some of those approaches, but we have not found anything that is of sufficient performance to do that. And it's also a pretty big deal to try to operationalize this at a local level as well. But we'll continue to examine what's in the realm of the possible and, the incorporation of testing into different aspects of reopening society for sure.
It's Dr. Newby, but I just can add on to what Dr. Tam has said in terms of you were talking about sort of, school kids and what's happening in the U.S. I think in many ways what's happening or what will happen in our schools here in Canada is also a reflection, as Dr. Tam has said, of what's happening in the local community. So I think it's very important to have a good understanding of how much the virus is circulating in any given community, because that would also dictate to what extent you might anticipate getting cases in the schools. For example, you were mentioning the U.S. I would say that certainly in certain communities in the U.S. where I think the lab positivity rate is quite high, probably over 5%, and so on, that if you have schools opening, then you might anticipate getting more kids testing positive. I can't really speak for England or United Kingdom, but I think here in Canada overall, our lab positivity rate is well below 5%, and therefore we wouldn't anticipate getting as many cases as you might have with school reopenings in other parts of the world. So I think that's important to keep in mind. And certainly as we move forward, we're certainly open to looking at best practices, what's happening in other countries, and certainly at a local level, we'll leave it to the public health experts in the provinces, territories to adapt and see what works best in their context. Thank you.
Thank you, Dr. Sharon. Follow-up question?
Yeah, as part of that, I mean, you talk about you're exploring new technologies, and I know that some epidemiologists and others are saying we need those fast, cheaper tests like paper strip antigen tests that, test saliva as well as nasal specimens. They may not be as good as PCR tests, but they could be a benefit to situations like school reopenings. And in some states like Arkansas, they've begun purchasing antigen testing kits and machines, and they're prioritizing them for K-12 schools, right? So is Canada working on evaluating and approving antigen testing?
Yeah, I'm aware of a number of technologies coming up that is currently actively being evaluated, including some of the technologies that you have mentioned, both from some of the laboratory public health labs, including the National Microbiology Lab, are helping to evaluate some of these newer approaches right now in reference to the tests that we have now, which is mainly PCR-based, lab-based testing. So absolutely, we're actively pursuing looking at that. And there has been a innovative process put out as trying to find the next technology available for Canada as well. So there's been some innovation funding provided to do that, and includes antigen testing. There are some of these newer approaches being submitted to the regulatory authority, Health Canada, right now. So they're also part of this effort to find us more sort of feasible, easy to use tests. We're also examining, and some of this is already going on things like wastewater monitoring, so that can potentially provide yet another approach to seeing if the virus is as a signal for the virus appearing in certain communities as well. So, yes, and just like the vaccine effort, the testing effort is going on all fronts to try and find us, the appropriate next technologies.
Thank you, Doctor. We will now turn over to the room. CTV.
Hi, doctors. Mackenzie Gray with CTV News. Dr. Tam, I want to follow up on something you said in one of your previous questions about performance for people who are asymptomatic to get tested. Is that you kind of saying that if you're asymptomatic and you get tested that you can't trust the results or the results aren't good enough? Is there kind of a number or an idea you have about making sure that there's a specific kind of assurance that someone who gets tested and is asymptomatic can know whether or not they can trust the results?
So obviously, how the testing can help depends on the context. So if you're a close contact of someone, or if you are part of an outbreak investigation, public health authority will look at testing asymptomatic people in that context. It increases what we call your pre-test probability of actually being a case. So if you just test the asymptomatic people out of the blue in completely an environment where there isn't a virus, then the potential for a false positive might occur. Now, we're not actually that worried about false positives. We can probably manage those under these conditions. But what is more important is that if you're testing someone with PCR technologies to look for the virus today, it doesn't guarantee that a negative test today means that you may not be positive tomorrow. So that is one of the issues is, if there's a strong likelihood that you could be a case, keep monitoring the symptoms because you may have to be tested again. At the beginning of an illness, in the first couple of days, there's very high false negative rates between around sort of 4 days to 8 days, that kind of time span. You're going to pick up the majority of cases. The sensitivity of the test is going to be quite high. After that, it might fall off again. So the timing of where you're in the clinical course will essentially inform some of the testing performance. So I think that's part of it. But some of the newer ideas are like if you have less sensitivity, but it still has to be a reasonable sensitivity, but you keep testing the same population again and again on a repeated serial basis, then the reduction in sensitivity may not be as much of a concern if you're able to keep testing people on a serial basis. And so some of those ideas are being actively explored in terms of, well, what does it bring in terms of an added strategy for Canada?
It's Dr. Maybe I'll just add a little bit onto what Dr. Tam had said. I think for the average Canadian, I think it's also important if you do go for testing and you're asymptomatic and you go in with a certain idea, you actually understand what the test is able to tell you and what it doesn't tell you. And I'm aware, I think we're all aware of situations where people, I think with the best intentions say, oh, I've been invited to go to a wedding. So maybe if I take a test just before then and it's negative, then I'm good to go. As Dr. Tam and others have mentioned, I've said it myself, is that it depends at the point of time you go for your test. If you're actually, maybe unfortunately were exposed to the virus just a day or so before you go for the test, you might well get a negative test and then have that false assurance thinking, oh, I'm fine, I don't have the virus, I can do what I want. And I think that's not the case. So I think people need to understand the limitations of the test. And even if you were to get a test, I think it would be good, let's say, if you were to go to that wedding, say, okay, at least I tested negative. But at that wedding, I would still recommend that all the wedding guests and so on still practice all of the other good public health measures, the physical distancing and so on and so forth. Thank you.
My follow-up question is about the vaccine, which you spoke about at length before. In the States, Dr. Fauci has said that it's not great that we'll get a highly effective vaccine, a vaccine that would be in the 98% range, which seems to be the gold standard of which, meaning will be totally okay to be going forward. He said he's hoping maybe we could get a 75% effective vaccine, but that they will approve a vaccine that is 50% effective. Is there a number in mind that you will approve a vaccine at? Is it 50% or above? And do you think that we will at any point get to a vaccine that will be in that 98% range?
Well, given that none of that data is actually available, I think it's difficult to actually give any kind of idea. I think this is why I believe there are now 8 phase 3 clinical trials. They will begin to give us an inkling on some of the effectiveness, at least related to those types of vaccines or technologies. So I don't think one can guess as exact level of protection. But even a vaccine that does not protect you completely from getting the virus could also reduce severity or serious illness. So that is another endpoint that the clinical trial approaches will look for as well. So I think that, I haven't heard of a specific number that the regulatory benchmark is aimed against. I think some of the clinical trials will sort of inform us. But, say if it's 50 to 60% protection, we may want to look at, well, does it also then reduce the severity of illness as well? And so I think those kind of results need to be sort of reviewed in a more holistic way for part of the regulatory approval process.
Thank you, Doctor. Prochaine question, la presse canadienne.
Lina Dib, la presse canadienne.
Question from Lina Dib from the Canadian Press. Dr. New, when you were replying to my colleague earlier, I heard you say that the Russian vaccine is surprising. Can you tell me why you used the word surprising? Answer, Dr. New. Thank you for the question. If we could know more about the process between the initial discovery of the vaccine and the approval, it would be helpful. We need to know how many people participated in the phase 3 clinical trials. I do not have the details of what transpired in Russia, and they are very important. Personally, for me and for experts around the world, we really do need access to the scientific basis for what happened in Russia. Then we can know more about the potential of the vaccine announced by Russia.
In terms of, from what I understand, in terms of when I think the potential vaccine candidate was first, I think, discovered or put forward in Russia, compared to the timelines for the various clinical trials to the point now where I think they've announced at least the approval of the vaccine. It seems quite short based on what we know about how normally vaccine trials go. As we've just said a few minutes ago, in terms of the phase 3 trials, the largest and in many ways the most important, where you're actually vaccinating, tens of thousands of people, seeing what happens over months, and then obviously analyzing the results and so on. That takes time, and so I think it is important. I think not for me personally, but I think for the real experts around the world to actually be able to get access to the Russian data, the evidence, the scientific information, to be able to understand exactly what has happened with respect to their trials, and then to be able to draw conclusions and have a better idea of the potential of this Russian vaccine.
Mon autre question.
Follow-up question. I know you don't like to criticize or comment on provincial health authorities, but yesterday, Quebec announced that masks would be worn in schools, but not in classrooms. I would like to hear the opinion of Canadian Public Health. You published guidelines, and so say if we have 29 children in a classroom not wearing masks, what is your reaction? Answer. I think that all experts and authorities across Canada in the domain of public health are on the same page. I am in frequent contact with my counterparts in Quebec, and I respect the decision. The decision that they made regarding their guidelines and taking into consideration all layers of protection. because it isn't a matter of simply what is done in schools or simply pertaining to masks. Of course, there are also the aspects of social distancing, ventilation in schools, and numerous other measures, including physical barriers and so on. From what I understand, the masks will be used in certain situations, for example, when students are in hallways and it is difficult to maintain social distancing. I think it is also important to maintain that social distance of 2 meters whenever possible. When it comes to other measures such as ventilation and wearing masks in the hallways, I think that they are all part of the whole. And I think that in Quebec took that into account. And I think this is also in line with what we said in our guidelines. Follow-up question. But you were saying that it is impossible to maintain social distancing in schools in many situations if there are 25 students in a classroom, etc. Answer, Dr. New. Yes, that is the challenge. And when it comes to teachers, students, parents, authorities, I think everyone needs to work together to come up with solutions in each case. Because as I've said, it won't just be one measure. And I didn't even mention this, but another important aspect is cleaning, disinfecting of the space, and ensuring that all students and teachers have easy access to hand washing stations with soap and water. The schools must come up with the best combination of layers of protection.
We'll now turn over to the phone for one last question. Operator, over to you.
Thank you. Merci. Our next question, notre prochaine question, is from Heather Urix-West from Global National. Please go ahead. À vous la parole.
Thank you for taking my question. And Dr. Tam, I just wanted to talk to you about class sizes. Given the experiences of countries like Israel, are you concerned that the majority of provinces have not committed to smaller class sizes, limiting the number of kids in classes?
I think, as everyone appreciates, education is in the sort of provincial, local domain. Our recommendation in terms of public health measures, of course, does recommend physical distancing. So it may depend on the actual context of the school itself in terms of the size of the classroom, etc. So I know that there are other measures also in looking at cohorting or putting particularly younger kids in little groups so that you limit the potential number of contacts engaged if there ever was a case in that situation to limit the spread or the number of contacts. So I know those approaches are part of the guidance that we would like to present for consideration, but they are certainly recommendations, and every school context might actually be quite different. So I think I think it would depend, and it would be a decision that would involve school boards, parents, local public health, etc. So, but I think we maintain that physical distancing is one of the key layers of protection in a school context.
Thank you, Dr. Heather. Follow-up?
No, those are all my questions. Thank you.
Thank you. That will be all for today's press conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui.